Good evening, everyone. Welcome to Carmel Friendship Bible Study. But today we're actually having the COVID-19 panel discussion. And so we thank you for tuning in, streaming in live, however you're streaming in. And we just thank you for being with us this evening as we get some really good information and knowledge. So let us go to the Lord in prayer. Father God, we thank you for this day. We thank you for this evening. God, we thank you for this opportunity, God, to learn more about our health and, Father God, learn more about this pandemic. God, we ask that even in the panel discussion today, that something is said or done to show people who you are, that points people to you, Father God. We thank you, Lord, for just being God, and we thank you for using us, God, and we just ask that you have your way in this discussion today. Lord, we thank you and we love you. In Jesus' name we pray. Amen. Amen. Now I'd like to turn things over to the leader of our health and wellness ministry, Sister Sherry Hall.
Thank you, Reverend Tiffany. Well, good evening, everyone, and welcome to an educational discussion on COVID-19 created specifically for our community. Once again, my name is Sister Sherry Hall, and I am the lead for the Health and Wellness Ministry, and in my personal life, I happen to be a holistic health coach. So I will be your moderator this evening, and sitting on the stage with me will be introducing two other members of the Health and Wellness Ministry. But before we do that, I want to remind you, we will be discussing masks this evening, so be sure to have it handy for that part of the discussion. So let's get started with our first panelist. Brother Greg, can you please introduce yourself?
Good evening, everyone. My name is Greg Spearman, and I'm Director of Purchasing for the City of Tampa Purchasing Department, and I serve on the Pandemic Response Task Force as the governmental liaison.
Great, thank you. And Dr. Hill, can you introduce yourself, please?
Good evening. My name is Angela Hill, and I'm a professor and Associate Dean of Clinical Affairs at the Tunasia College of Pharmacy at the University of South Florida. And in my capacity as Associate Dean, I also serve as the Program Director for We Care, which is a community outreach entity for the college that allows us to interact with the community.
Great. So as you can see, we are blessed to have in our congregation folks that have expertise and talent to help direct this discussion this evening. And I'm also thankful as well that we have a pastor and a leadership team that really stepped in as this pandemic kicked off, and they listened to the experts. They were able to take information from members of this team in order to make sure we were doing the right things for this church. And if I may make a shameful plug, the Health and Wellness Ministry is sponsoring this event, but we are also in need of volunteers or members for other activities that we have coming up. So if you're interested in joining us, we would love to have you. Please type Health Ministry in the comments section and someone will reach out to you. So tonight we're going to be breaking this discussion down into 4 segments. The Pandemic Response Task Force, COVID education, protection strategies, and of course last, COVID vaccination, at which time we'll have an additional panelist expert join us on stage. During this segment, we will in fact give you an opportunity to ask questions after each segment. And in the event that we do not answer your question live, we will be capturing all questions and providing them back in the form of a frequently asked questions list, which will be distributed later in the week. So with that, we will get kicked off. So why don't we start first with Brother Spearman. First off, can you tell us, how did the Pandemic Response Task Force get started? And then what exactly is it?
Well, on the slide you'll see momentarily, it has the location of the Pandemic Response Task Force, which is under the Health and Wellness Ministry, and the Health and Wellness Ministry actually reports to Pastor Q. And on the Pandemic Response Task Force, there are 4 members. Reverend Tiffany Bell is the task force lead. Yours truly, Brother Greg Spearman, is the local government liaison. Brother Thomas Shaw is our CFC facilities representative, and Sister Romera Shackelford is our task force coordinator and monitor of state and federal COVID-19 statistical data and CDC guidelines. So the question is, what is the Pandemic Response Task Force? Well, it's an assembly of carefully selected and appointed volunteers within various segments of Carmel Friendship Church, or the congregation, organized together to ensure that CFC responds effectively during times of general emergencies and pandemics. So you may be wondering, what is the role of the Pandemic Response Task Force? The task force monitors pandemic conditions and leverages all available local, state, and natural resources. There are several activities that you see on the screen that the task force is responsible for. So our past activities include the following: development of the Carmel Friendship Pandemic Response Plan, training of ministry leaders who train their volunteers, and providing recommendations on sanitation protocols and screening practices. As far as our present activities are concerned, the task force continues to conduct surveillance on local, state, and national health and governmental agency data, as well as recommendations to guide our current efforts. Under CFC leadership and the Health and Wellness Ministry with the current situation report, and lastly, to evaluate the capacity of our current physical location as relates to adherence to safety guidelines, as well as implementation of a safe and effective transition. And lastly, when we look at our future activities, these include researching current best practices for sanitation and infection control, making changes to the CSC Pandemic Response Plan as the data and the science dictates, and lastly, providing applicable training for CFC staff and volunteers to remain in step with the relevant changes in the pandemic response.
Okay. Well, thank you, Brother Spearman. So tell me, what if members or visitors want to come to the church? What should they do?
Well, if any members or visitors are desirous of attending a church service, they should call the CFC main line at 991-1300, or they can email the church at info@cfriendship.org and let us know that you're interested in attending. Because of social distancing protocols and the need to maintain a 6-foot distance, it's very important that we limit the number of individuals who actually come to the church for a church service. And once you attend, you do have to wear a mask, and there are protocols we will ask you. For an example, if you have a fever, if you have chills, if you have been around anybody with COVID who's COVID positive, and of course, we will be doing a temperature check as well.
Now, in the past, we had multiple services, and so one of the questions we keep getting is, will there be multiple services so that more people can attend?
And that's really a great question. Right now, we can't be definite in terms of multiple services because we're still monitoring the pandemic. And as you have been noticing in the news, the rates are still rising. The Pandemic Response Task Force will be giving information back to church leadership in terms of what the data is telling us. And once that data tells us that it's safe, then we'll consider it that time. But for right now, we're going to limit in-person services due to the rising rates in the pandemic. And we're also going to be monitoring that as a task force. Previously, we did have 3 services. So we'll just have to wait and see what the science and the data tells us, and we will determine what will happen after that point.
Great, thank you. Do we have any questions on this segment? Okay, great. Okay, so let's move into the COVID education segment. So one of the things we did is we asked the members of CFC to complete a couple of poll questions. And so if we look, the very first poll question is related to, do we know someone who has had COVID? So Dr. Hill, as you look at the results, thank you, CFC, for responding to the survey, the poll. 124 respondents answered, and as you can see, 81% said yes, they know someone that's been impacted. Do those results surprise you?
Well, they don't surprise me much, but they kind of disappoint me. And unfortunately, as Brother Spearman said, we're still in the midst of a pandemic, and it's a strong indication that we cannot let our guard down. Unfortunately, Hillsborough County, the numbers are going up. And a lot of it has to do with, yes, we've had major holidays passing. We've still had some degree of athletic activities and things of that nature, but people are not probably adhering to the CDC guidelines as much as they should. And people have resumed, travel. They are working and moving around a lot more. So unfortunately, those numbers are very telling.
So what are some of the risk factors you're seeing?
Well, particularly as we look at our congregation, and there are some serious concerns in terms of risk factors for those individuals that have a lot of comorbid problems, which are really prevalent in the African American and Hispanic population. You see a higher risk factor. I know when the pandemic started, there was a lot of conversation about the elderly, and a lot of reasoning behind that was because they have a lot of medical problems. But what we're finding is that it can affect anybody and everybody. If they're exposed, because the virus actually, as we know, travels primarily through our secretions from our mouth and nose, and so it's so important that we wear these masks to try to protect ourselves and just stay separate from each other as much as possible. Wash our hands and all those kind of things.
Got it, got it. So on this next slide, you can see that how African Americans compare, thank you, to other nationalities. Anything stand out there to you?
So what I think we probably want to walk away with is noticing that compared to our Caucasian counterparts, African Americans and Latino and the Native Americans are almost 2 times more likely to contract COVID. And I think we have another picture for you to just kind of show. Part of the problem really lies in the fact that those groups actually are the ones that have a lot of those health problems that I referred to. So when we look at the pattern of patients that have been hospitalized with COVID, we're noticing that they're coming in predominantly with diabetes, hypertension, cardiovascular disease of some sort, renal problems, pregnant and the like, and that is the essence of why those populations are affected, not to mention the fact that a lot of the individuals in those races are essential health workers, they're service providers, they're exposed obviously to a lot of people just in the day-to-day work that they do. We have, unfortunately, health discrimination and health disparities that have been going on for years, long before the pandemic actually came about. But what we have noticed is, unfortunately, overcrowded housing and certainly work conditions, and the fact that we've had health disparities prior to are all now contributing to what we're seeing, and these individuals are the ones who are more, unfortunately, at risk. And so it's crossing socioeconomic, guidelines and the like, and so again, we can't emphasize how important it is that we protect ourselves as much as possible.
Got it, got it. Now, we noticed that diabetes is really right at the top of the list of one of those items for underlying conditions. And I want to remind everyone that this is Diabetes Awareness Month. And incidentally, the Health and Wellness Ministry will be hosting a diabetes awareness panel next week, at which really our focus has been, like you kind of talked about, prevention, working to really bring that awareness, but also prevention. So we really don't want to see our communities overrepresented in this area. So I know as we get into COVID testing, during the early stages of COVID, I knew several people that had symptoms, and they basically refused to get tested. Part of it was they were afraid of what was involved in the testing, and then the other thing is they were concerned, is my name going to end up on a list somewhere? Can you talk to us a little bit about testing and what information can you share with the audience on that?
Well, The testing is pretty daunting if you've ever had it, but the testing does allow us at least to be able to detect if people actively have infection or if they've had the infection in the past. And so I actually have a video to show everybody so they can appreciate the different types of testing and actually what is entailed, and then perhaps we can talk a little bit more. But it is so important to kind of answer your question about the need for testing. It just helps us to identify how many people are affected by the disease, and certainly pick up on these patterns like comorbid problems and things of that nature. And certainly because we don't have a cure just yet, we need to certainly identify individuals as much as possible so we can eliminate the spread of the disease. So if we can go ahead and see the video, you can appreciate what testing entails and the different types of testing.
As part of its effort to respond to the COVID-19 pandemic, FDA plays an important role in helping to support the development of accurate and reliable tests in the U.S. There are two main categories of tests in the fight against COVID-19: diagnostic tests and antibody tests. Diagnostic tests can tell you if you currently have an infection. The FDA has authorized many diagnostic tests for COVID-19, including molecular tests. Molecular tests work by looking for the virus's genetic material in a sample from you. The sample is then usually analyzed in a lab. For some tests, the sample can be analyzed at the point of care, such as at a doctor's office. FDA-authorized molecular tests are very accurate, and results are returned anywhere from minutes to several days, depending on the test. Antigen tests are another type of diagnostic test that see if there are viral proteins in a sample taken from inside your nose with a swab. These tests are often simpler and may provide results quicker than many molecular tests, sometimes within minutes in a doctor's office. Although antigen tests can be less accurate and may need confirmation with an additional diagnostic test, they can be made more widely available because they're easy and simple. The other category of test is an antibody test, sometimes called a serology test. Antibodies are produced by your body when you're infected by a virus, and they help your immune system fight off the infection. An antibody test detects antibodies to the virus using a blood sample. If an antibody test finds antibodies in the blood, it likely means the person has been previously infected with the virus. Antibody tests do not show if you have a current infection, and they should not be used to diagnose a current infection from COVID-19. The results from antibody tests can help us better understand questions about exposure to COVID-19 by helping identify who has been infected and has developed antibodies, if antibodies may provide protection from future infection, who may still be at risk, or who may be eligible to donate a part of their blood called convalescent plasma, which may serve as a possible treatment for those who are seriously ill from COVID-19. If you have questions about COVID-19 diagnostic or antibody tests, talk to your doctor. Testing is crucial to guiding our next steps in the fight against COVID-19. For more information on FDA's efforts to ensure Americans have access to high-quality tests, please visit fda.gov.
So as you can tell from looking at the video, actually it's not too invasive, but it probably is a little surprising and a little unnerving, but it does tell us a lot of information in regards to the virus. And so certainly we would encourage an individual, if they think they've been exposed, depending on some of the symptoms that sometimes accompany it, that should determine whether or not they should seek out testing. I think we started out thinking that the fever would be the hallmark feature, but everyone doesn't always have a fever. So things like a sore throat or even coughing, shortness of breath especially, chills, weakness, loss of taste, loss of smell, those are things that certainly warrant us needing to seek medical attention. But it may not necessarily always test positive immediately because of certain processes in the body, but definitely a health professional will let them know. And so paying attention to who we're around, who else may be sick, and those things are very important.
Got it, got it. So if you are around someone who tests positive for COVID and you don't have any symptoms, should you get tested or should you just ignore it?
Well, we won't say totally ignore, but certainly quarantining yourself as best possible is also, something to consider. Sometimes there's a little resistance to testing immediately because there has been a shortage of tests. We're working kind of through that, and depending on where you go and inquire about testing, they may say, well, just go quarantine yourself and we'll watch and see, because it may be sometimes as many as 2 days or 4 days. We've seen 12 days or 14 days before symptoms actually occur. So quarantining is very helpful in that regard. But definitely if any of those symptoms start occurring, earlier than that, then that's a sign to go forward. But you can always ask the question about whether or not you should seek testing.
Got it. I think we have a question online.
Yes, a question from Sister Tish. Can you provide us with information about post-COVID exposure as it relates to proper quarantine timelines? And is there reinfection of the virus after you have the virus?
Well, some of those questions are kind of hard to handle. Right now, we're still sticking to the 14-day, around that period of time as a quarantine. Usually people who do have symptoms and they're mild in nature, they're not resulting in hospitalization or things of that nature, oftentimes they will abate by that point. And so the quarantining may or may not be necessary, but a health professional will advise you as to how long you really should quarantine. Now, to certainly answer the question about reinfection, there actually have been cases we've had one in Hong Kong, one in France, one in Reno, Nevada, where we've noticed what may suggest a reinfection. And I think in the case in Hong Kong, it was about 4.5 months before the second exposure. There had been some travel in between, so that may have contributed. The case in Reno was the same situation, but it was the person contacted it in April, and then it was May when they got reinfected. And what seemed to be a pattern was a milder experience with the disease, but that is something also that varies between the individuals, their risk factors and all. So we can't 100% answer just yet whether or not that will be the case for everybody, and that is why we say continue to practice the CDC guidelines, quarantining and protecting yourself as much as possible. And I would invite our other panelists, Dr. Sneed, if you wanted to chime in on that and add anything to that, you're welcome to as well.
I think you did very well.
Okay, thank you.
Was there another question as well?
We have 2 more questions. Sister Tish also asks, what are your thoughts or recommendations about participating in the vaccine studies?
Well, we are going to talk a little later about the vaccine, so perhaps we can just wait until the end and address that question.
Absolutely. One more?
When are you able to donate plasma after you have recovered from COVID?
Actually, that's probably the best time, too. The convalescent blood actually is what would contain the antibodies that would be most helpful to hopefully help treat individuals. And so certainly at that point, we would suggest there is an actual national effort to actually collect that. So if anyone is interested, that's some information that we could provide at a later point beyond this workshop.
If you have tested positive, how many negative tests do you need to have after testing positive before you're deemed to be clear of the disease?
Well, that question's a little convoluted as well. So I have seen some employers that require 1 negative test, some employers require 2 negative tests, and then we are still figuring out how long the immunity lasts once you recover from the disease based on some of the treatments. And so that is very individualized in terms of when you will be allowed to, say, get back to work or be exposed to other people. But again, your healthcare professional will kind of guide what that plan of care is going to be, and in a manner that is going to protect you from others and others from you. So that could vary. That's not totally definitive.
One more? Go right ahead.
Can panelists address the new CDC definition regarding length of time of spreading as it relates to being in close vicinity of someone who may be positive, knowingly or unknowingly?
Dusty, do you want to take that one?
Yeah, I can try and address that one. Should I look anywhere in particular or,
So we're looking
oh,
at-
right here, okay. Yeah, the guidelines just changed recently, and before, they wanted to kind of express that you need to be in the vicinity of an individual for about a 15-minute period. Now they've kind of reduced that, and they're saying you don't have to be immediately with an individual for 15 minutes. Now, it can be a lot less than that, and it's going to be a total time period in a given area. So it could be 5 minutes here, 5 minutes there, but if you're in the vicinity of people, especially in a closed environment, for a cumulative 15-minute period, then that could be considered an exposure, but it doesn't have to be a single individual anymore.
Got it. Thank you so much. Those are great questions. We certainly appreciate it. I think right now we do have another panelist, so I think I'd like to take the time for a moment to have Dr. Hill, if you'd like to introduce Dr. Sneed, please.
Well, yes, it's a pleasure. So Dr. Kevin Sneed is currently the Dean of the Tunisia College of Pharmacy and Associate Senior Vice President in USF Health. He's a pharmacist like myself and very well known in the Hillsborough County area, the Tampa Bay area, for not only his philanthropic work and his work as a pharmacist and as an academic clinician, but certainly for the volume of work that he's done with the community. He is the founder of We Care, the community engagement entity that I described earlier. That was his brainchild, and he has both vision as well as passion about healthcare, health disparities, and certainly just a wonderful person and a God-fearing person. So, and some of us refer to him as our boss. This is my boss.
Okay,
So
great. We'll take one more question before we move on.
How dangerous is the virus to children?
Well, this virus is dangerous to everyone. It does not discriminate, unfortunately. It does seem to not affect children as maybe as much as we've seen in elderly, primarily because of differences in their immune system, differences in terms of the health problems that children have compared to aging individuals and the like, but it is certainly a risk factor for them.
Wonderful. Thank you again for all the questions. We'll have another open segment for questions shortly. So as we move into protection strategies, you talked earlier, Dr. Hill, about comorbidity rates among African Americans and the different ethnicities. And you provided a slide on this next page that shows a breakdown of racial disparities in chronic illnesses. Why was it important for you to share this slide?
So really wanting to hone in and emphasize the importance of us needing to manage our chronic care problems, because that increases our risk for COVID. And that's the reason why we're saying that, it's maybe we're more twice as likely to actually be at risk for COVID compared to other groups. And this slide just shows just how Hispanic and African American individuals are at higher risk, one for COVID because of comorbid, either hypertension, obesity, and or diabetes. And so certainly things like just managing these diseases are very important, because certainly there are organs that unfortunately can be affected not only by the diseases themselves, but by the virus. And so we have seen cases of renal failure, we have had problems with strokes and clots and all things that just suggest that this virus is relentless. And so for individuals that already have these kind of chronic diseases, their immune systems are compromised, and then there's inflammatory processes already that are taking place in the body that are heightened in the face of illness. And so certainly, and I know you would know, being a wellness coach, how important it is for us to exercise and do those kind of things that lead to self-care. So on that, I'm going to switch the flip and ask you a question. And what would you say would be very helpful in terms of preventing COVID, and what are some strategies that we should think about, particularly for people not just with these kind of disorders, but as we're trying to fight off this pandemic?
Well, great. Thank you. There are, on the next slide, kind of a list of things that we really want to focus on when it comes to health and wellness strategies. So first and foremost, we know that COVID really ravages your immune system. So first we want to start by suggesting that folks increase your body's immunity, and there's several ways you can do that. First of all, drinking plenty of water. Now, I know I've heard people say, hey, if we drink hot water, can that kill the virus? No, it can't. But you need water to keep your kidneys strong, your liver to keep things flushed out of your system. So drinking half your body's weight in water, in ounces rather, is strongly suggested. In addition, good sleep is extremely important. You hear the pastor talking frequently about he needs to get home to get his sleep, etc. And good sleep, 7 to 9 hours of sleep per night, good restful sleep, helps to not only strengthen the immune system, but it also helps your body to fight against chronic illnesses. And then you can look at green vegetables and orange-colored vegetables. Those are really strong in improving immunity. And then, of course, we live here in the sunshine state, so getting 30 minutes of sunshine per day gives your body natural vitamin D and helps your body to replenish it more easily in your system. There's certain things you should really stay away from that impact or rather weaken your immune system. Those are things like sugar, artificial sugar, processed foods, so high sodium diets, as well as alcohol consumption. And so you talked about earlier, Dr. Hill talked about comorbidity rates, and you look at things like high blood pressure, et cetera, they're directly related to these things that weaken the immune system. And then lastly, we want to work on strengthening our lungs. So that's exercise, and if you can do that exercise outdoors, all the better, because you're getting fresh air at the same time that you're getting sunshine. And then, of course, if you smoke, we know, there's certainly information about smoking, but quit. Work to start to eliminate that habit. And then lastly, reduce mucus, excess mucus in your body. And once again, if you've got chronic illnesses, you should be eliminating as much excess mucus as possible. Those are found in things like dairy products, wheat products, et cetera. Okay? So as we look at that, anything else from your perspective, Dr. Hill, that you would think of from a medical standpoint?
Well, certainly as a pharmacist, some of the things that I'm noticing is people taking products like elderberry and zinc and vitamin D and C, and those supplements have their place, but I just wanted to certainly make sure that people didn't have false hopes in them and that they're preventing us totally from getting the COVID infection, but they do actually help support our immune system and those kind of processes. But there has been data out there that's shown that when there are deficiencies in vitamin D or deficiencies in zinc, certainly that does lend itself to poorer outcomes and people being able to fight off the infection. And so I just want to emphasize, as you talked about, getting that daily sunshine is so important, in terms of helping the body naturally produce that vitamin D. And unfortunately, Black and brown populations are more at risk for deficiencies in vitamin D, partially because of the melanin in our skin. But again, so many of us are staying inside a little bit more than we need to. And so definitely getting as much sunshine as possible would help, but not overdoing it with these vitamins, because certainly there are certain amounts that can then be kind of problematic as well.
Okay, great. Now, there's a certain politician, we heard him say that he took hydrochloroquine before being diagnosed with COVID. Did you suggest that people take stronger prescription drugs to prevent the onset of COVID?
No. Part of the reason is that it's led to, unfortunately, shortages in a lot of these many needed medications, and the literature doesn't prove that they're necessarily curing anything. They are used certainly in situations where we have acute infection and or you see patients hospitalized, but to take them prophylactically or in a preventative manner is not necessarily appropriate. Yeah. So what we do want to just emphasize is prevention is key. And so washing your hands for 20 seconds. And I like to tell people every hour on the hour, soap and water. A lot of people want to use hand sanitizer ad nauseum. And the alcohol is fine, and we do want at least 65% alcohol in any hand sanitizing products. But wash your hands. Just wash your hands. The other thing is certainly avoiding touching your face and your eyes especially, definitely, with unwashed hands is really important. And then certainly we want to be mindful of those that you're coming in contact with. And again, as we mentioned, for those situations where you have a crowded or a busy household, spacing as much as possible and quarantining when someone gets sick, because we've heard about entire households, entire families, being infected, and so we need to be mindful. I think, certainly just some common sense. Cover your mouth when you sneeze or you cough, and just staying away from people when you're not feeling well. And being honest when the screener asks if you've had a fever or chills, or if you're, feeling sick in any way, please don't, unnecessarily expose people. But I do think this would be a good time to maybe do a demonstration of what wearing the mask is. So you kind of gave everybody some homework, so hopefully everyone has their mask, and I'm going to put mine on and see if I can figure out how to hold the microphone while I put mine on. And I know no one in the church is surprised that I have my FAMU mask on. But what I would say is that we see things like this, and this is not appropriate if we're going to wear a mask. You need to make sure you're covering that nose, and that ideally that mask is covering or under that chin. Notice how the mask is also not quite to my ear, but it's pretty close to it. Now I'm going to ask my model if she would come up front, the Reverend Tiffany, and she is donning a fashionistic shield in addition to a mask. And so often we see people wearing the shield, but they don't realize that that virus can get under the shield if we don't have a mask underneath. So I would suggest that, again, if you're going to wear the shield, particularly if you're contemplating traveling or you have paranoia, you can, about this, make sure that you have a mask on under your shield, so that, again, you're not allowing these particles to fly underneath. The other thing I would emphasize is getting a cloth mask and cleaning them frequently. Hanging them from the door, be a little careful, because we just incubate all kind of germs that then you put back over your mouth. But I'd like to thank Reverend Tiffany for demonstrating. And then you can certainly sanitize those shields as needed. But definitely, this is the key to prevention
Got it.
in that regard.
Let's transition over to treatments. Can you talk about some of the treatments for COVID-19?
Okay, so you kind of brought up hydroxychloroquine earlier, and it's an example of where we have in the pharmacy world repurposed a drug. And a lot of the reason why hydroxychloroquine came up as a potential target for treatment was based on our experience with the SARS situation years back and MERS. We've learned a lot about the anti-malarial drug. But we have three basic categories: the antivirals, the anti-inflammatories, and then we have antibody treatments, as was mentioned with the convalescent blood or plasma. Right now, we don't have a cure, so we are working hard to try to get a vaccination in place, or a vaccination protocol, so that we can have what we call herd immunity, much like we do with the flu and the measles and the chickenpox. So our best treatment at this point is not to get it. And then second to that, in the event that people are hospitalized, oftentimes they end up hospitalized because they may have pneumonia or other complications from COVID that result in them needing assistance with breathing, which is an essential living function kind of thing. But right now, that's kind of where the treatments are in terms of categories, and they all have their pluses and minuses. We're still studying them, and it's unfortunately a situation that we're learning as we go, so everything is absolute, and every day it's a very dynamic situation for us.
Now, you just talked about SARS for a moment, and incidentally, I might have been exposed to the SARS coronavirus back in 2003 when a group of my coworkers returned from a business trip in South Korea. Am I more at risk, or people like me, am I more at risk of getting COVID-19 because of that?
Well, Dr. Sneed, let's talk about this. This is a nice case study. See what you say, and then I'll tell you my piece.
No, actually, you would not be at more risk if you've been exposed before. In many ways, you may actually have some level of immunity built into your system now. We have found that it may not be enough to all the way cover the current SARS-CoV-2, but because you may have been exposed before, or even if you were exposed to the common coronavirus, which cause, common cold or even the flu, like a flu-like symptom, your body has an immunity, and you build up what we call T cells. And so if they come into contact with another coronavirus at that point, you actually may have an initial level of immunity that many other people may not have, but it may not be enough to all the way ward off infection from this current coronavirus. So no, you're not at more risk. You're probably have a step ahead of other people.
And what's your thought, Dr. Hill? Anything different from that?
No, I agree. All of these viruses are like brothers and sisters to each other, and they kind of mutate, as time passes, much like the flu vaccine. And so, as he mentioned, yes, your body would almost immediately recognize that this is a similar virus and mount an attack. But like you said, we can't guarantee any outcomes in that regard. And so, yes, you still have to follow the CDC guidelines.
Okay, great, thanks. Well, you mentioned the flu vaccine. Let's go to the second poll question that we asked. And it was whether or not you had or planned to get the flu vaccine. So why was it important for you to have this question on the poll? Incidentally, 65% of the people plan to get it.
So, right now, what we don't want to have is a flu issue as well as a pandemic going on. We just don't know what that means, particularly not having a cure for COVID. But what we need to do is everything possible to strengthen our immune system as much as we can. And so a lot of people have been concerned that they're going to get sick from the flu vaccine, and subsequently that's going to increase their risk for COVID, but that won't be the case at all. And we just really are, unfortunately, almost terrified at what January and February may look like for us, because it's predicted that that may be the peak time by which we see a COVID almost resurgence because of where we are with the flu season. And so I'm really proud that we've had as many people say that they've had their flu vaccine or plan to get it, and just would encourage more to reconsider. But if you don't want to have the flu vaccine or can't tolerate it because you have an egg allergy, or you have something like Guillain-Barré or something, talk to your healthcare provider about some of the oral substitutes, but any protection is going to be better than no protection at this juncture. So I'm not sure, Dr. Sneed, do you want to add anything there?
Yeah, I would strongly encourage many people to get the flu vaccine this year. This is 1 year you do not want to get the flu and then come into contact with the coronavirus. We actually have a name for it now. We're calling it the twindemic, okay? The potential to have both. And the first case in America just came up about a week ago out in, I believe, in California and San Francisco. And they're watching that individual very closely. And so if at all possible, if you've been one to say, I just don't want to get one, or I'm afraid to get one, like Dr. Hill said, unless you've had a definite reaction in the past, this is 1 year that you definitely do not want to take the chance, because if you come into contact with the flu virus, there's a great potential that you can also come into contact with the coronavirus at the same time. And this is 1 year that the level of damage that could cause to your lung issue, or your lungs in general, that would be a bad issue to have.
And if I'm not mistaken, I think last year's flu season, there were still between 20 and 60,000 deaths. And so just imagine how that would add to the mortality we're already seeing with COVID.
Got it. Sister Tanya, we have time for one question.
Is there any definitive data that points to any newly medically defined long-term conditions developing as a result of having COVID, such as COVID toes or rashes.
I have seen situations with the rashes. Some people are reporting it's starting out on the face, going away on the face, coming up on the chest, and moving around different parts of the body. I have heard of that. I've heard of sometimes the lingering coughing or shortness of breath. I've also heard individuals who've had predisposed other medical problems seem to have a flare-up of them that require more attention, more aggressive attention, and then it's taking them a lot longer to perhaps rebound and kind of come back. So one of the things that has also been scary is the impact on the brain. And as you all know, I work a lot with Alzheimer's patients, and so I'll be talking this Friday, actually. WeCare is sponsoring another workshop, and we'll be discussing the connection that we're discovering regarding Alzheimer's disease and the COVID infection, and there may be some genetic commonalities there that we can explore, but what we are noticing is that people are suggesting that they're having problems with memory, as well as focusing and attention span, but the fatigue also seems to be another factor that seems to kind of just linger in some patients that have had COVID. Have you seen? Mm-hmm.
Yeah, the COVID toe condition, that is real. It's rare. Another condition, and we talked about children earlier, although, again, very rare for children to really have definite complications. They do have a condition known as multi-inflammatory syndrome. And this is almost like where they develop that widespread rash over the body. And it can be quite serious for them. Even though that still is rare, but whoever was asking the question about COVID toe, they've definitely been doing good reading, and I would just like to assure you and assure all of you that it's a rare condition that we have found in a few people.
Got it. Okay, so we're going to transition quickly into vaccinations. And so once again, we're pleased to have Dr. Sneed on the panel. We keep hearing, Dr. Sneed, about COVID vaccines coming soon. And a lot of people are fearful of taking them. What can you tell us, can you give us a basic overview of how vaccines work?
Yeah, absolutely. And the first thing I will share with all of you, there are about 4 or 5 different types of vaccines that are in development right now. So when we keep hearing in the news about the vaccine or a vaccine, there are multiple types of vaccines that are in development, number one. But when you get vaccinated, all we're doing is trying to have your natural immune system kind of produce antibodies that can be ready in case you come into contact with, in this case, the coronavirus. It's very important to understand that we have to vaccinate you long before you come into contact with the virus. And so we definitely, this would be another time that we really want people to go out and really consider getting the coronavirus. We know there's a lot of mistrust out there. People feel like it has come along at a very high, very rapid rate. One thing I can assure you, we've been studying this particular kind of vaccine now for about a 15-year period. It didn't come out of the blue, and that is really the only reason we've been able to turn key so quickly. But definitely when you get injected with any vaccination, it's really causing your body to build up its own natural antibodies, preparing you for the situation when you may come into contact with the virus. And at that point, you have antibodies ready to protect you so you don't get sick.
So will this vaccine be similar in any way to the flu vaccine in that you'll have to get it every single year to stay free of COVID?
We believe that probably will be the case, especially now. One big difference, right, as far as the ones that will probably come on the market the quickest, you will have to get 2 shots. I know people don't want to hear that, but I know my gentleman said, no, I don't want to hear that at all. But no, you have to get an initial shot, and then you have to come back about a 21 to 28 day period later and get a second one. And that will be the only way that we can ensure that we have enough of the vaccine in you to be able to produce that antibody. But but clearly, moving forward, for anything that may come on the market anytime soon, be able to, you can come to someone like myself or Dr. Hill, another healthcare clinician, and find out what type of vaccine that you have, that you are being given. There is not just one type. They work a little bit differently, but I had and I have to share with you later, I had a great phone call today with the president of the National Medical Association, and that's the Black Doctors Association. And we were just sharing with each other that for all the different ones that are going to come out, the initial one that probably will come out and be available by January or February is probably the very safest one. And if it were available today, I personally would get that one. Now, the other ones that are in development, I probably would take a look at the studies a little bit more. They've all proven to be safe, but the one coming out probably in January or February, the way it works in your body, it is, I think, eminently safe. Brand new type of technology, and overall, the only downside, you have to go and get 2 shots. But we will probably get to a point where you have to go and get your annual coronavirus, because I don't think the coronavirus is going to go away anytime soon.
And Dr. Steen, I just kind of wanted to add that a lot of people are concerned that they would be injected with COVID, kind of in line with how they perceive the flu vaccine, but we just want to assure everyone that that's not the case, that they've replicated the RNA or the genetic material from the virus and actually put it into healthy cells, and that's what they would be injecting into individuals. And the people that would be in line to get it would be those that are coming first in contact with patients all the time, doctors, nurses, and those kind of stuff, but that we're working hard to make sure that the health disparities that have traditionally taken place where people who are affected most are denied access, that doesn't happen also. So individuals like Dr. Sneed are working really hard to make sure that we have equal access, in that regard. So just kind of want to assure you on that.
And Dr. Hill, let me add on to that. Anytime you get a vaccine, but in particular the coronavirus vaccine that's coming out, you may experience what you think are symptoms of getting sick. And it's not you getting sick because of anything that was given to you, other than the fact that your body is now trying to produce that antibody, okay? And when your body jumps into hyperdrive to naturally produce the antibody that is going to protect you, you may develop a short-term fever, or you might have a little bit of a chill. We have seen that in a few clinical trials, but it has only lasted for about a 48-hour period, about a 2-day period. And the overwhelming majority of people that took Tylenol actually reported no problem. So we don't want people to feel like, oh yeah, I got it and I immediately got sick from COVID. No, you're not being injected with COVID at all. Okay, we want to assure you of that, I can promise you. But when your body is trying to produce that antibody very quickly, you actually may feel a little bit shaky just for about a 2-day period. It's okay. Promise you, you'll be fine. If you take Tylenol, if you're eligible to take Tylenol, that should control that, and then 2 days after that, you'll be fine with no problem.
So who is participating in these vaccine trials? I don't know if you have any information about it in general that you could share?
I've got plenty of information about it. Yeah, I have been monitoring all of the clinical trials for 6 companies now. And depending on where you are in the world, not just the country, in the world really determines who's been participating. But up until now, only 2 companies have really had what I would consider a requisite number of African American and Latino participants in the study. We needed a lot more early on, and even one company extended the trial to make sure they got more diversity in the trial. But so far, every indicator, and this is a really important point, and I'll stop here, but for every individual around the world that has gotten the vaccine in a clinical trial, nobody has died. Not one single individual has died from the vaccine. but we all know someone that probably has succumbed to being infected by the virus. And so here's where I give a message of, the vaccine, let's give yourself a chance to live. You may be the one individual, if you become infected, you might not have any symptoms at all. Or you might be the individual that has very, very bad outcomes. But not one individual around the world, and we're talking all throughout Europe and South Africa, all throughout Brazil, and all across the United States, not one single individual has died. The one individual that died in a clinical trial actually got a placebo and not the actual vaccine. And that individual had a stroke, and they just had a health condition. So, we want to remove that fear factor. And I would encourage all of you to take a chance to live and get the vaccine when it's available.
Got it. Well, we certainly appreciate everyone tuning in for this session. As you can see, there is a wealth of information that can be discussed on this topic, and the Health and Wellness Ministry will be sending out a survey following this session just to get your feedback on the information that you heard, and then we can take next steps from there. In the meantime, any closing comments, Dr. Sneed or Dr. Hill?
I know you all covered it earlier. African Americans and Latinos, in particular, black and brown people, we are far more susceptible. Let's do everything we can to protect ourselves. We deserve the right to live. 20% of everybody, even though we only make up 13% of the population, 20% of all deaths are African Americans. So let's make sure and we do everything we can to protect ourselves.
And I would just like to add that University of South Florida is committed to helping with the fight against the pandemic, offering testing as well as clinical services and working hand in hand with Tampa General and other healthcare institutions in the area to try to help combat the pandemic. So if anyone ever has any questions about where to go for services and things of that nature, certainly feel free to ask.
Okay. Thank you for all your questions. We will collect all of the remaining questions that were not asked. And at this time, I will be turning it over to Sister Audra.